Assalamu alaikum warahmatullahi wabarakatuh. معكم Amirah AlDakhilAllah. In this video we'll be talking about community acquired pneumonia. راح نتكلم عن the definition of pneumonia, the classes, the organisms causing pneumonia, signs and symptoms, and lastly the diagnosis and management. So first let's start by defining pneumonia. It's a lower respiratory tract infection in a non-hospitalized person. Any history of hospitalization is very important. It can be associated with symptoms of acute infection with or without a new opacity on chest radiograph. فالchest radiographic changes ما هي أساسية to diagnose someone with pneumonia. Acute, or in other words, it's an acute infection of the pulmonary parenchyma acquired outside of a healthcare settings. There are 4 classes of pneumonia. أول واحدة community acquired pneumonia, which is the most common. The second class is healthcare associated. It can be of 2 types. It's either hospital acquired. In hospital acquired, there is the rule of 2. So it should be 2 days after admission or 2 days after discharge. And there is ventilator associated. The third type is aspiration pneumonia. للpatients اللي عندهم risk of aspiration راح نتكلم عنهم in the other slides, and pneumonia and immunocompromised such as HIV patients. ايش الorganisms اللي ممكن تسبب pneumonia؟ لما نتكلم عن الorganisms there are typical and atypical community acquired pneumonia. Typical, it's caused by typical bacteria. Most commonly, the most common cause في أي شخص أي أحد عنده risk factor is streptococcus pneumonia. Haemophilus influenza, it is common في smokers and COPD. فلما يجيك patient, this patient is a smoker ولا عنده COPD, the first thing you have to think about strep pneumonia. إذا ما كان عنده strep pneumonia, then you think about Haemophilus influenza. Other bacteria such as group A streptococcus, aerobic gram-negative bacteria, Moraxella anaerobes, and Staph aureus. Atypical community acquired pneumonia, it can be caused by atypical bacteria or respiratory viruses. Atypical bacteria أهم شيء فيهم تقريبا Legionella they will present with GI symptoms. بيكون عندهم diarrhea nausea vomiting. There is also mycoplasma, chlamydia, and coxella. في respiratory viruses, it can be caused by influenza A and B viruses, adenoviruses, rhinoviruses, parainfluenza virus, and now it's very important to think about coronaviruses زي الماس اللي هو Middle East Respiratory Syndrome ولا COVID-19. طيب لما نجي للrisk factors, risk factors are very important in any case. أول شيء older age. أول شيء we know with older age there will be increased risk of comorbidities and chronic conditions, فراح يزيد الريسك of any infection. الشيء الثاني بيزيد عندهم الريسك because they lose the elasticity of cilia in the airways, so they cannot clear their airways, which will increase the risk of infections. Chronic comorbidities such as COPD, chronic lung disease زي bronchiectasis and asthma, chronic heart disease, stroke, diabetes, malnutrition, and immunocompromising conditions. باختصار again any chronic condition will increase the risk. Viral respiratory tract infections. في viral respiratory tract infections it can lead to primary viral pneumonia. يعني pneumonia it can be caused by viral infection. طيب it will predispose to secondary bacterial pneumonia. فلو كان الشخص عنده upper respiratory tract infection caused by viral طيب وبعدها they develop pneumonia, يا أما أنها تكون نفس الانفكشن اللي سوت الupper respiratory tract أو أنه زادت الريسك بأنه يجيه bacterial infection. طيب في impaired airway protection ذكرنا الأشخاص اللي عندهم risk of aspiration زي مثلا الأشخاص اللي عندهم stroke, seizure أو في وقت الأنستيزيا طيب لما نجي للchest radiograph we can see consolidation زي في هذه البيكتشر، أو we can see a cavitary lesion or cavity. في الكافيتي we can see air fluid level. air fluid level لما يكون في cavity وفيه air وفلويد، يعني فيزيائيا الفلويد راح ينزل تحت والاير راح يكون فوق، فبيكون في خط فاصل بينهم. This is the air fluid level. لما تكون الكافيتي في الupper zone always think about staff. يعني ما هي قاعدة بس you should consider it. مو شرط لما يكون في cavity it's always staff، لا، بس it can help you يعني. لما تكون في lower zone، في lower zone think about anaerobes، لأنه ذكرنا قبل إنه الanaerobes تكون associated with aspiration. لما يكون في aspiration احنا ذكرنا قبل، تذكرون من الاناتومي في لما نجي للبايفركيشن في البرونكاي عندنا الرايت برونكس والليفت برونكس. الرايت برونكس it will bifurcate early قبل الليفت برونكس، فأي شيء راح يدخل لللنج it will go to the right side. When it goes to the right side by gravity it will go to the lower zone، فالكافيتي راح يكون هنا. ولast thing interstitial infiltration. طيب when it comes to the management, now you have decided أو أنه high suspicion that this patient has pneumonia based on the clinical signs and symptoms and the chest radiographs. The first next step is to decide whether you will treat this patient as an outpatient, you will admit this patient, or you will treat this patient in the ICU. ففي score اسمه CURB 65 severity score. This score is composed of 5 elements. كل حرف في الCURB 65 severity score راح يعكس الكلينيكال فاكتور تبعه. فنبدأ في السي. السي if this patient has confusion or not. إذا كان عنده confusion this is 1 point. اليو you will measure the blood urea nitrogen. So إذا كان blood urea nitrogen more than 19 this is 1 point. نجي بعدين للR. الR for respiratory rate. إذا كان more than or equal to 30 this is 1 point. بعد الB for the blood pressure. في blood pressure إذا كان systolic blood pressure less than 90 أو diastolic blood pressure less than or equal to 60 this is 1 point. ولastly الage. إذا كان الage more than or equal to 65 this is 1 point. طيب فالآن أول شيء إنك حسبت البوينتس من الكلينيكال من السيناريو اللي عندك. بعدين نجي للانتربريتيشن. إذا طلع السكور 0 or 1 this is a low risk patient, so treat as an outpatient. تعطيه antibiotics و discharge. إذا كان السكور 2 points admit this patient. إذا كان السكور أكثر من 3 so this patient will need ICU admission. آخر نقطة راح تكون عن المانجمنت. احنا قلنا انه المانجمنت كلها راح تعتمد على السكور للبيشنت. فإذا كان السكور للبيشنت ما بين 0 to 1 you will treat this patient with azithromycin as an outpatient from 3 to 5 days. An alternative could be doxycycline or amoxicillin. إذا كان السكور 2 points so this patient will be admitted and treated with a combination of ceftriaxone and azithromycin. إذا كان السكور more than 3 so this patient will be in the ICU and will be treated with piperacillin and tazobactam. It's a combination زي الأموكسيسيلين clavulanic acid. الcombination هذا it can be also called peptaz or tazocine. في عندنا other conditions. في حالة إنه كان عند المريض high risk of methicillin resistant staph aureus you will treat with vancomycin. لو كان عنده high risk of pseudomonas you will treat with levofloxacin. with the last thing إذا كان عنده high risk of aspiration so you will choose clindamycin. and that's it. I hope it was clear. وبالتوفيق.